Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. I had about a half a cup of coffee this morning. My voice is still a bit, morning-ish. So I apologize for that up front. I guess we'll get through it anyway, won't we? So, some exciting news because the VA is looking to expand this specific benefit that will actually impact family members, right? So your spouse, dependent children, that type of stuff. And it's broadening its reach, its coverage, and so forth. And anytime that type of stuff happens, it helps us in the veteran sphere save money because we don't need to go outside. Now I'm going to read you the headline. You'll know what it's about, and then we'll jump into it. Please hit the thumbs up, subscribe, share with a friend, all that good stuff. I truly appreciate it. All right, so the headline here is VA to expand healthcare coverage to veteran family members and caregivers through CHAMPVA. All right, this just came out the end of April of 2024. I wanted to share it with you here today. So let's jump into it. All right, VA will soon expand coverage for medical services, including mental health care for family members and primary family caregivers participating in the Civilian Health and Medical Program of the Department of Veterans Affairs. That's the long name for CHAMPVA. So CHAMPVA is great. You can get your spouse and any dependents on there, as well as the caregivers. Now, one of the things that's interesting about CHAMPVA is it will oftentimes act as a supplemental kind of insurance, picking up the loose ends from a primary insurance for healthcare. However, if you do not have a primary healthcare in place, CHAMPVA can move to the front and become the primary health insurance for your loved ones. Now, you have to inform CHAMPVA of that change. So if you had a primary insurance first, and you had CHAMPVA enrollment for your family members or caregiver, then that primary goes away. Now CHAMPVA needs to be the primary. You need to call the VA, CHAMPVA folks, and let them know of that change so they can set it up. All right. It'll save you a lot of money when you go to the pharmacy, that type of stuff, to have it switched. They just need to know, though. All right, so let's move on. There's a quotation here. Our mission is to provide world-class care to our nation's heroes, which include care provided through CHAMPVA to eligible family members and caregivers of veterans, said the Undersecretary for Health, Sharif Ellenhall. The extension of these additional services is part of VA's continuing efforts to ensure CHAMPVA beneficiaries can access high-value care where they need it, when they need it. And I'll tell you, CHAMPVA has kind of been I don't know if it's been a back burner thing, but it's felt like it's been a back burner program. So I'm glad that it is getting some light and some attention here. So there are three main bullet points that I'm going to run through, and it says here is what this means for CHAMPVA beneficiaries. So whether you have CHAMPVA now, or you could be on the pathway to that. Currently, what you need to have is a veteran who is rated 100% permanent and total. 100% permanent and total does not mean that you are the worst of the worst. That's a whole other rating schedule. And I like to say that because some people self-segregate out of even trying to attempt to get to 100% because they think that that's reserved for the most severe of us. That's not the case. Special monthly compensation would be the appropriate rating schedule for those folks. So being 100% permanent and total opens up the doorway to CHAMPVA. Now, I'm going to run through the 3 bullet points here for you right now. Access to audio-only telehealth. With audio-only telehealth coverage, beneficiaries will have expanded access to care, which is particularly important for rural beneficiaries. The coverage will also be retroactive. Providers and beneficiaries who received audio-only telehealth services on or after May 12th, 2020 will have until November 26th, 2024 to file claims for reimbursement of covered care, getting reimbursed for any of that type of care, going all the way back basically 4 years from now. Moving on, the next bullet point is the elimination of caps on visits for mental health and substance use visits. CHAMPVA beneficiaries will no longer be limited in the number of visits for mental health and substance abuse services. Additionally, beneficiaries and providers will no longer need pre-authorizations for outpatient mental health visits in excess of 23 visits per calendar year and or for more than 2 sessions per week. That's fantastic, and that's the way it should be. Moving on, third bullet point here, eliminating deductibles and cost sharing for certain necessary contraceptive services. VA is also eliminating deductibles and cost sharing for contraceptive services or contraceptive products approved, cleared, or granted by the Food and Drug Administration, the FDA. Moving on, that's the 3 bullet points, the 3 big changes. Moving on in this press release, currently there are more than 737,500 CHAMPVA beneficiaries, so about 750,000 CHAMPVA beneficiaries. CHAMPVA is a healthcare program for certain spouses, surviving spouses, children, and primary family caregivers of eligible veterans. Though CHAMPVA, or through CHAMPVA, VA shares the cost of medically necessary healthcare services and supplies with eligible beneficiaries. This includes mental health services, inpatient and outpatient services, prescription medications, transplants, ambulatory surgery, family planning, maternity care, and more. To learn more, you can also go to or Google search CHAMPVA, that's CHAMPVA, care at VA, right? And you'll find that in a Google search. The CHAMPVA website is a very long website. From the VA. It's got the, va.gov/health/dash, all that stuff. So you could just Google search CHAMPVA, look for the official VA website, and click on that for more information. I've done videos on CHAMPVA in the past. And again, I think it's a great program. If you qualify for TRICARE, you most likely will not qualify for CHAMPVA. You can't really run both of those programs. But CHAMPVA is a great program. Like I said, it takes care of everything, and you can front load that as your primary insurance if you have no other insurance. So with that, thank you so much for watching. I appreciate each and every one of you. Have a great one, and remember, if we don't take care of each other, something went wrong.